How long should I use antibiotic ointment after eyelid surgery?
Antibiotic ointments such as bacitracin, erythromycin, and Tobradex can help with healing after eyelid surgery. However, it is important to know that antibiotic ointment should be used for a limited time, as prolonged use can lead to an allergy which can delay the recovery process. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm well known as a go-to specialist for cosmetic eyelid surgery, such as for hooded eyes, ptosis, under-eye bag removal, and Asian double eyelid surgery. I'm also known as well as an eyelid specialist for revision surgery for eyelid surgery complications and reconstructive surgery after trauma and malignancy. When it comes to eyelid surgery aftercare, many people with the best intentions will apply liberal amounts of antibiotic ointment, resulting in them running out of ointment in the first 1 to 2 days. Some people will believe that they're helping their healing process by applying antibiotic ointment for weeks after surgery. In my practice, I advise my patients to use antibiotic ointment for the first few days after eyelid surgery. I recommend applying ointment conservatively with a swab or Q-tip to avoid any dirt or bacteria from the fingers making their way to the incision. For the lower eyelids, I recommend a small amount to be applied with the tube on the edge of the lower eyelid, similar to the placement of eyeliner. As far as the limit of using the ointment for a few days is concerned, I want to help my patients avoid developing a condition called contact dermatitis. Contact dermatitis is characterized by redness and itching. Ironically, many people think the redness and itching represent an infection, which they treat with even more antibiotic ointment. Consequently, they're making their allergic reaction worse. After a few days of antibiotic ointment use, in order to create the optimal moist environment for healing, I advise my patients to use a petrolatum-based ointment such as Aquaphor. Again, the ointment should also be applied with a Q-tip. After sutures are removed, for example in upper eyelid surgery, I advise my patients that during the first few weeks after surgery, which is referred to as the proliferative phase of wound healing, it is normal for the incision to be slightly thick and red. I find that the fear of keloid scarring motivates some people to buy over-the-counter scar treatment ointments. I advise my patients not to do that. Some degree of itch and redness are normal for several weeks after eyelid surgery. In situations where itching and redness becomes intolerable or you suspect possible infection, you should immediately check with your doctor. I follow my patients after eyelid surgery closely with regularly scheduled office visits so I may observe their progress and advise them accordingly. It is important to continue communicating with your doctor during your healing process. If my patients are concerned about their appearance, I always ask them to come in for me to see how things look. I keep an open communication policy, so if my patients have questions about any healing products which they come across online, I review the information and advise accordingly. I hope you found this information helpful. Thank you for your question.